Now the session is open for a discussion. I ask the speakers to come to dais.
I thank all the speakers for excellent talks. I'll set the ball rolling for the discussion by asking Dr. Ram Kumar. I saw one slide where the latest guideline of the Endocrine Society says target up to 8% HbA1c in for preoperative thing. I think I was very surprised with this.
Actually, none of our surgeons are ready to wait till the HbA1c is under control. So I think that is probably the reason why they have added a second statement. If HbA1c cannot be controlled below 8%, at least targeting 100 to 180, because most of the patients in my hospital, they are getting admitted mainly for surgery. And even the sugars are not under control, they invariably take up for surgery. If you don't clear them for surgery, they will send to some other endocrinologist.
In COVID, with the usage of steroids in the inpatient, we are using high doses of insulin. And despite that, sugars were not controlled and had many opportunities of using OHAs in supplement. What's your experience of using OHA?
Sir, even when I was given this topic, the main thing I also wanted to know whether are there any guidelines which actually mention OHA to be used in inpatient management. Unfortunately, no. Only DPP-4 inhibitors. I do not know how much the DPP-4 inhibitors are going to reduce the blood sugars in a severe hyperglycemia. Maybe it can reduce as I mentioned, it can reduce the insulin requirement to some extent. But I'm not sure whether it. But I actually use a lot of patients on other OHAs, including sulfonylureas and metformin, especially those patients who are taking on a regular diet. But unfortunately, no guidelines mentioned that to use metformin or sulfonylureas. There are some doctors whose patients, physicians who refer the case for diabetes management, even they are also very clear that they should not use any oral drugs, then they should control only with insulin. So for my patients I use and I don't find any complications. Although the textbook says the risk of hypoglycemia is more, I find it more with insulin rather than with sulfonylurea. Probably maybe we choose the patients, not that the main problem with sulfonylurea they mentioned is a sustained hypoglycemia, that it's very difficult to treat if they are not eating and you give a sulfonylurea. I think the patient selection is more important. I'd also like to know from Dr. Satish, whether do you strictly avoid all, there are certain, even in the guidelines as clearly mentioned, in some patients we can still use it.
Actually, for mild cases, we can use just DP4 inhibitors. We have used it.
DP4 inhibitors, now the guidelines have also cleared, you are going in favor of it. Regarding other, suppose no liver dysfunction,
If the
metformin
glucose
and
intolerance
sulfonylureas
is on the higher level, then insulin is the only choice. Maybe even in those cases,
like
you can use DP4 inhibitors to decrease the insulin dose.
Even on DP4 inhibitors and even on maximum dose of insulin, is there any role for sulfonylurea or metformin? I think that's what you're asking.
Probably in non-critical illnesses, when the patient is admitted for non-diabetes related illnesses, I think we can use the OHAs in hospital admission.
The main reason they are mentioning is about the safety and efficacy. Regarding the safety, we already mentioned about lactic acidosis. If those contraindications are not there, I don't think we will avoid them. And for sulfonylurea, the only concern is hypoglycemia. And obviously, we are going to consider that only when the sugars are really going to be high, even on insulin.
Audience.
Sir, this is a question to Professor Naik. Good evening, sir.
Yeah.
Nice that you gave good recent informations, but you really scared me. Let me tell you, I am a hypothyroid patient for the last 25 years, and I'm presently going on with 200 micrograms of Eltroxin daily. So I also had, in the second wave, incidentally, I was COVID coordinator for Pondicherry State, so you know how much I had to run about here and there. I had been with COVID in the second wave, May last year, and this time with Omicron also. Now, my fear is my voice was not like this. It's over 2 months that my voice has become little gruff. There is a change in it. I do have neck pain, but their last slide really scared me, telling COVID, post-COVID is really producing hypothyroidism. I'm a known case of hypothyroidism. Will it aggravate people who are hypothyroid? And will they have to add on more thyroxine? As such, I'm 200. So do we have to increase the dosage of thyroxine is my question. Second thing, what should I do further? Will it get aggravated more? And my voice, I want to get back because I'm a singer too. So your answer, sir.
To your first question, you are telling whether I have risks to develop this kind of a problem or not. Because if you look at the percentage of population which has developed this cervical thyroiditis, Graves' disease are very minimal. And these studies are primarily done on patients, those are euthyroid at the baseline. So going to whether you have risks for developing any other problem is very unlikely, unless particularly if you have a thyrotoxic features, then you can think of, but very unlikely you can develop these symptoms. And with regard to your treatment, is primarily depends upon your thyroid status. You cannot increase the dose or something. It's best predominantly if your thyroid function is within the normal, there may not be worry to. Then you may need to readjust the dose. Yeah, it may have to reorder the dose, or you need to look for if there is any other things which are interfering your absorption of thyroids. There may be several other factors responsible for having persistently high TSH, as in normally what we see in the OPD, maybe rather than thinking it is due to the COVID.
Even now, your voice is very nice, madam. No problem.
My question to Dr. Ramkumar, sir. Sir, you didn't mention anything about alpha glucosidase inhibitors in non-critically ill patients admitted with normal HbA1c, only stress hyperglycemia, patient taking orally normal diet, sir. Shall we use alpha glucose inhibitors if postprandial alone is increased?
I think some of the review articles they mentioned that mainly because of they're not that efficacious, one, and because of GI issues that usually not considered during even for non-critical ill. That's
usually patients with diabetic foot infections admitted for treatment. So they don't have any GI symptoms?
Yeah,
previously.
actually, I think even in Apollo, there are many consultants who use actually alpha glucosidase inhibitors. I've seen a lot of prescriptions on patients on alpha glucosidase inhibitors. So these are, but as you know, this is not a much stronger drug when compared with other gliptins or sulfonylureas or other sulfonylureas. So I think for mild cases, I think gliptin is safer. But if you want to use alpha glucosidase inhibitors, if there are no GI concerns, I don't think it's any issue.
Thank you.
Only there's no safety issue. That's
So the discussion is over. We'll conclude the session. I congratulate the Trendo team for having organized such a wonderful mega scientific event after a long time. I think this is the first mega event post-COVID. And my sincere thanks to the organizers for giving me the opportunity to be one of the chairpersons for this excellent session. Thank you. And before concluding, okay, we'll conclude the session.
Thank you, sir. Thank you. Thank you, speakers, and thank you, chairpersons. Sir, please don't go. Sir. It's an honor always to facilitate the speakers. I would like to ask Sridhar sir to honor Satish Kumar sir with a memento. Sir. I would like to invite Dr. Syed Sultan sir to honor Dr. D.B. Naik sir with a memento. It's an honor to invite Dr. Ramkumar sir to be felicitated. Sir, both the chairpersons can do. I invite Dr. Shanmugala sir to honor the chairpersons. Dr. Syed Sultan sir and Dr. Sridhar sir. Yeah. Sir. With this, we are closing the day of sessions and we'll proceed to the industrial symposium, starting with the Eris team. Industrial symposium, yeah.
Yeah, good evening to all the doctors. This is Balachandar. I'm a divisional sales manager of Eris Life Sciences. And I welcome you all on this platform. And it has been a very nice day. And at the end of this day, we have been allotted this symposium, and we are very glad to welcome Dr. Gopinath, our chairperson for today's evening program. Doctor, I would like to request you to welcome Dr. Shanmugavel, our today's speaker.